The NHS means everything to me. It's a comprehensive service that is available to all of us from cradle to grave.
My cousin, he broke his ankle and he had to wait 2 hours for an ambulance. He was laid on back doorstep in agony like. That's the trouble, isn't it? It's just accessing it when you want it, isn't it?
So to me, the NHS is a family of people who all want the best for patients, who want the best for their communities, a group of people who care.
It seems to me that the NHS is understaffed and overmanaged.
I mean, NHS, since it was set up in 1948, means providing world-class health service free of charge, and it's for the people, not the ability to pay.
It shouldn't be a postcode lottery, should it? It should be the same care in all over the country, really.
My family have had cancer and serious illnesses. I've had 2 babies in the NHS and they've always been safe and well and cared for, and yeah, it's absolutely vital we have an NHS.
Throwing more money at the health service doesn't seem to be improving it at all.
I think the confidence in NHS certain services is all-time low.
And it's becoming so much under pressure, and we don't want people to leave either. We want people to stay, want homegrown talent, and I do feel that's been driven away, and if we can bring that back, that is really important.
If the GP services are made more robust, then that will have less strain on the hospitals and the A&E services.
Increasing the volume, getting more patients through of any complexity.
There's hospitals in different parts of the country all need to work together, don't they? So mistakes aren't made.
I think I could make the NHS better for signposting my family. If they want to go to the hospital, I'll say, well, actually, have you explored the other facilities that we have? Have you experienced out-of-hours care?
I feel there needs to be more work in the community to prevent people from actually attending the hospital. I think there should be more services to deal with minor injuries and things what can be dealt with by the GP or community teams.
Accessibility wise, all we need to do is send a text message and then we can get an appointment quite quickly.
If somebody got slight flu or certain things, they don't need to go to A&E. There's other means, for example, local pharmacy or various other means as well.
I think the whole country needs to look at themselves. They can't just expect the NHS to always dig them out of illnesses, the smoking and one thing and another.
The biggest change needs to be the general public. They need to take more care of themselves.
So if you're going to get fat, then your joints are going to get weaker, and then of course you need knee replacements, hip replacements. It all costs money, doesn't it?
I think we could educate children better so that we're doing things from the bottom up instead of always trying to be reactive to the problems that are there now.
So it's very, very important that NHS should be the forefront of everything.
The NHS is a valuable asset to the nation. It is really important we sort things out. Because we don't want to lose it.